Excellencies, distinguished guests, dear colleagues and friends, thank you for joining us today for the presentation of the first progress report for the Global Action Plan for Healthy Lives and Well-being for All. The Global Action Plan is a collaboration between 12 multilateral health, humanitarian, and development agencies that have committed to working together to support countries to accelerate progress towards the health-related targets in the Sustainable Development Goals. The Global Action Plan works to support national plans and priorities through 7 accelerator themes and our commitment to gender equality. The heart of our mission is to deliver a tangible impact where it matters most, in countries. The progress report outlines how together we have moved from the 4 key commitments of the Global Action Plan to engage, accelerate, align, and account to action, and we are now laying the groundwork for sustainable impact. 5 case studies demonstrate how the plan is grounded in joint support for countries and how it has increased trust, social capital, and working relationships among the agencies. The report outlines how together we will continue to help countries protect the health gains they have achieved, recover from the COVID-19 pandemic with more resilient and sustainable health systems based on primary health care, and continue in our efforts to achieve the health-related SDGs. In the face of the many challenges that countries face from the COVID-19 pandemic, our shared mission of coherent, coordinated support from the multilateral system is more important than ever. Strong, sustained leadership and the support of member states and partners are critical to achieving this ambitious goal. I now give the floor to Peter Singer, who leads the GAP Secretariat, to present the findings from the report. But before I move to Peter, I would like to thank the Pathfinder countries who have brought the idea first, that's Germany, Ghana, and Norway, for their leadership. Thank you so much. Peter, you have the floor.
Thank you very much, Dr. Tedros. I will, in the next few minutes, present some of the key messages of the report, which was launched today, and these are as follows. This is the first progress report that talks about the progress of the Global Action Plan since its launch in September 2019. It does show how the agencies have moved collaboratively from the commitment that they made and the plan to action. It shows that countries are at the heart of the Global Action Plan. It shows that a lot of the work has happened through the accelerators and our commitment to gender equality. It shows that the working relationships among the agencies have improved. It also is quite honest about some of the challenges that have been faced, as this is a mid to long-term really mechanism for improvement. And some of those challenges, as outlined in the report, include the need to double down on the institutionalization of collaboration in all the agencies, right down to the country level. The need to really hear the encouragement of countries, of partners like those of you watching, for the agencies to keep collaborating and to strengthen collaboration. And then finally, the need to work even more closely with civil society partners. And that's a commitment that we will pursue over the coming year. In terms of going down one granular level of detail, the agencies are working, as Dr. Tedros said, with 5 countries that are detailed in the report, but also many others through the primarily primary healthcare and sustainable finance accelerators so far. So countries like Mali, Pakistan, Somalia, Ghana, Cote d'Ivoire that are featured in the report, but also Egypt, Ukraine, Malawi, Sri Lanka, Laos, Tajikistan, Kenya, Myanmar, Zimbabwe, and others. The accelerators of primary health care and sustainable financing that I've mentioned, but also communities and civil society, determinants of health, fragile settings, data and digital, innovation, and gender equality as an overarching commitment are up and running. We're working to align our processes, to institutionalize them in agencies, and we're working to account for our progress. And this progress report is a beginning of that accounting process. We've looked at how we evaluate GAP in an evaluability assessment, laying the groundwork to a 2023 independent evaluation. And we started to transfer some of the lessons to other SDGs as well, Sustainable Development Goals, such as the acceleration framework for water and sanitation. In closing, I just want to reiterate the 4 watchwords of GAP that were also in Dr. Tedros' remarks: challenging, essential, leadership, and results. Collaboration, of course, is challenging, but it's essential, because if we've learned one lesson through COVID, it's how important the multilateral system is, particularly for the most vulnerable in the world, and how important it is that we strengthen our collaboration. Leadership is required to do that, and although collaboration is a process, the real issue here is results. It's getting back on track towards the SDGs, accelerating progress towards the SDGs, and thinking about that individual at the country level and that family who is helped by the support that multilateral agencies working together can offer to countries. I'd like to thank all the agencies, their heads, and all their staff, and all our partners, and everyone who's encouraged us along the way. And thanks to you, Dr. Tedros, and the leadership of WHO and all the agencies. And with that, I'd like to give the floor to Jude Osei, who will take us through the rest of the program as our moderator. Jude, thank you very much.
Thank you very much, Dr. Singha, and for the excellent work that you and the Secretariat have done to push this process along. I think you've outlined throughout these few months on building this very important Global Action Plan. I believe we have joining us today the head of UNICEF, Henrietta Fore. We are very pleased to have you, ma'am, and we would like to give you the floor to make your remarks, and then we'll take up the other principles as well. So you have the floor.
UNICEF would like to congratulate each one of the countries that have taken full advantage of the Global Action Plan and accelerated actions to achieve sustainable results on the ground. I would particularly like to commend the countries profiled in the progress report: Mali, Pakistan, Somalia, as well as Ghana and Côte d'Ivoire, for sharing their results so far. The progress shows leadership by governments with support from partners in challenging environments. UNICEF is proud to be a part of this. UNICEF, together with WHO, is committed to supporting countries with strengthening primary health care. In these times of COVID, our actions must accelerate the full resumption of activities for essential health and social services, especially for the most vulnerable and marginalized children. Investing in primary health care is a political choice and one of the best investments any country can make. I have asked our offices to support your efforts to strengthen primary health care and immunization, to reopen schools safely and resume basic education, ensure wash and effective infection control and health facilities, as well as to provide mental health support for adolescents and vulnerable populations at national and subnational levels. I know that among the services that are showing early recovery are those organized at the community level. We must find a way to accelerate and support quality services for women, children, and adolescents in all facilities and primary health care centers. Finally, UNICEF calls on world leaders and partners to make bold investments in accessible primary health systems and the many systems that support them for every community and every child, and to make it a truly equal world for all. Thank you very much.
Thank you very much, Executive Director for UNICEF, and for your invaluable contribution to this process. We will now like to invite the Executive Director of the Global Fund, Mr. Peter Sands, to have his brief remarks. So you have the floor, please.
Thank you. Excellencies, distinguished guests, I'm delighted to participate in the launch of this report and to express the Global Fund's commitment to the purpose-driven, pragmatic collaboration that the Global Action Plan seeks to deliver. If we ever needed convincing that collaboration was important, COVID-19 has demonstrated the imperative for all of us to work together at pace and with flexibility to leave no one behind to defeat this virus. And ACTA, the Access to COVID Tools Accelerator, has proved a remarkably successful mechanism, even though it's early days, for achieving such collaboration in this context. Through GAP and in ACTA, we have learned a lot about how to make such partnerships impactful. Indeed, as a collaborative partnership itself, the Global Fund has collaboration in its DNA and has itself learned an enormous amount about what makes collaboration work and what gets in the way. Let me just highlight a few of the points I think are important in this context. One, collaboration has to be purpose-driven, with a focus on delivering, as Tedros said, tangible outcomes, saving lives, improving people's health. Collaboration as an aspiration without purpose just leads to lots of meetings. Second, collaboration has to be responsive and led by the needs of countries and communities. We must recognize that while the 12 agencies involved in GAC are powerful and capable, it is not these agencies that will deliver SDG3. Our job is to be the enablers, to support you in the countries, you in the communities, in your own efforts to deliver health and well-being for all. Third, we must be pragmatic and flexible. In some situations, all GAP partners are involved, but in most, it's a subset. And in some contexts, the most critical partners we need to collaborate with are outside the list of Global Action Plan signatories, be it implementer governments, bilateral development partners, or civil society organizations. We need the Global Action Plan to be open and inclusive. A fourth point, successful collaboration is always based on trust, and that in turn is based on transparency, on facts, on differing incentives and priorities, on things that haven't gone so well so that we learn from them. And we must make sure as we progress on this journey that we stay true to these imperatives. GAP is a powerful platform for increased collaboration between the health-focused agencies in the world. But it won't happen automatically, and it'll need sustained leadership and commitment to be a success. One aspect of the Global Action Plan that has made particularly rapid progress and is arguably of particular importance right now is the Sustainable Finance Accelerator, led by the World Bank, Gavi, and the Global Fund. The Sustainable Finance Accelerator has built on previous collaborations between these agencies to ensure greater coordination and coherence in our efforts to support countries ensuring sustainable financing for health. The economic disruptions of COVID-19, which everyone on this call will be well aware of, accentuate the vital importance of this work. And I, from a Global Fund perspective, am delighted that we are playing our part in making this accelerator work and progress so successfully. So I welcome the 2020 Progress Report and look forward to continuing to work with our Global Action Plan partners and our partners in countries and communities to help those countries and communities accelerate their progress towards SDG3, healthy lives and well-being for all. Thank you.
Thank you very much, Peter, for briefly outlining the pillars for a successful collaboration. I have the pleasure now to invite the Chief Executive Officer of the Gavi Alliance, Dr. Seth Berkley. You have the floor, please.
Since the launch of the Global Action Plan at the UN General Assembly last year, Gavi has taken concrete and tangible steps towards its implementation. I therefore welcome the launch of this first joint progress report. Peter's already talked about the Sustaining Finance for Health Accelerator, which we co-lead with them and with the World Bank. And this has been, as he emphasized, a particularly important collaboration on the issue of domestic resource mobilization, better value for money, and more effective development cooperation. And we see this, to the points he made, as excellent, purposeful collaboration where together we can work with countries to make progress. We are working with our partners on the other accelerators as well, but in some sense, I see this as a model for the ways that we can work better together. Today, in the 68 countries that Gavi supports, more than 10 million children are still not receiving the most basic vaccines. And reaching these zero-dose children and setting them on the path to full immunization by bringing them into a regular primary health care system is a high priority, especially now in the context of COVID-19, where we're seeing, in fact, many more families be put into this position. The pandemic's severely disrupted routine immunization, with lower income countries particularly affected. So it's important that the GAP agencies work together and with countries to maintain and restore these routine immunization systems, as well as other essential health systems, with a view to reach underserved communities through integrated primary health care that my colleague Henrietta has already mentioned. And this includes using innovation to build back better, which could be a silver lining to what we're trying to do. Obviously, strong routine immunization is also going to be critical as the backbone for ensuring equitable access to COVID-19 vaccines when they are available, which is the objective of the COVAX facility. Equity is at the heart of the Global Action Plan and the 2030 Agenda for Sustainable Development. And what happens in country is what really matters. This is what we have to hold ourselves accountable to. Along with GAP partners, Gavi will continue to drive efforts towards leaving no one behind, and we look forward to working with you to help ensure that the goals of healthy lives and well-being for all can be achieved. Thank you.
May I now warmly invite the Executive Director of UNFPA, Dr. Natalia Kanem, to make her interventions. You have the floor, ma'am.
Dr. Tedros, Excellencies, colleagues, friends, UNFPA is happy to join and reaffirm our commitment to the Global Action Plan for healthy lives and well-being for all. So much has changed since we gathered at last year's United Nations General Assembly to launch the action plan. And the road to 2020 has been made steeper by COVID-19 as countries and communities and families are scrambling to face challenges like never before. So like our UN partner agencies here today, UNFPA mobilized immediately. We were on the ground where it counts. And from the outset, we understood the urgent needs of women and girls, especially around the axis of sexual and gender-based violence. UNFPA has been there to provide sexual and reproductive health services, and especially to look after the needs of mothers and newborns. We are partnering to maintain an uninterrupted supply of contraception because many women do not wish to become pregnant under these circumstances. And the challenge of barriers going up all over borders and internally has been quite a logistical nightmare. We've also helped midwives with procuring personal protective equipment and so many other health workers who, of course, tend to be female in most circumstances at 70% of the health service. The alarm about the urgency to prevent and respond to women and girls affected by gender-based violence is something that we've advocated integration into every aspect of the health response. And lastly, and critically, we are providing population data disaggregated to the best of our ability, using digital technologies and geospatial elements to allow policymakers and service providers to be able to have the right information at the right time to reach those most in need who should not be left behind. For us, the pandemic has confirmed these three things: how badly the people of the world need universal health coverage, so we reach the most vulnerable and marginalized first; the importance of strong and resilient health systems functioning in countries; and the absolute essentiality of working in concert together. UNFPA has welcomed the Joint Progress Report. It reflects our efforts to date. And what we see is the only way forward is working in concert even better together. The COVID crisis, I believe, has shown the value of the accelerators that we identified, and we're keen to see more synergies as we now accelerate, and that health system strengthening be the one element that's cross-cutting across all of them. And lastly, and it's been said, delivering on the ground where it counts is the most important. This will take collective leadership. It will take innovation to build up health systems and community resilience and a strong connection to country needs. And above all, the sustained commitment to supporting and coordinating with the national investments in public health systems and a whole of society approach that puts people and their well-being at the center. Thank you.
Thank you very much, Dr. Kanem, for underscoring the need for UAC and strong health systems. May I now invite Dr. Mohamed Pat from GFF and World Bank. You have the floor, sir.
Thank you, and thank you, Dr. Tedros, Honorable Ministers, Excellencies. The Global Financing Facility and the World Bank welcome the first progress report. I would like to acknowledge WHO's leadership and all the key agencies and Pathfinder countries for their role in bringing this collaboration to life. This report tells us that better collaboration is not just a plan anymore, but is already happening in practice and beginning to yield important results. Collaboration is not an end by itself, as Peter alluded earlier, but a means to deliver improved health outcomes for all. It works when we align our efforts behind country-owned priorities, plans, and their resources. The GAP is about enabling countries to drive changes necessary to improve health outcomes and achieve their SDG targets. In a world afflicted deeply by the COVID-19 pandemic, the work of the GAP agencies at the country level is more important than ever. For example, the work of the Sustainable Financing Accelerator that was mentioned by both Seth and Peter, and the PHC Accelerator are important channels to engage countries on prioritizing health spending and ensuring improved efficiency of that spending through quality primary healthcare systems. We must build on these early achievements and existing efforts as we deepen our collaboration to deliver on our commitments as signatory agencies of the GAP. In the 36 GFF-supported countries, the country-led partnership model can offer a framework with concrete and tested tools to implement the GAP approach and translate the GAP goals and aspirations to the national and local levels. We must continue to respond and support lower-income countries and their call for long-lasting partnerships and alignment behind their national health plans and priorities, and making a permanent shift in the global health and development paradigm. The World Bank and the Global Financing Facility stand ready to play their role in this agenda and ensure that we collectively build back better. Thank you.
Thank you very much, Dr. Pate, for underscoring the need to support low-income countries to build their health system. May I now invite the Deputy Executive Director for UNAIDS, Shannon Hader. You have the floor, ma'am.
Great, thank you. Greetings and echoing thanks on behalf of Winnie Byanyima And thank you especially, Dr. Tedros, for your leadership throughout the Global Health Action Plan. Particularly crucial when multilateralism is most needed, but is also most stressed and even under attack. In 2018, GAP signatory agencies committed to support countries to accelerate progress on the health-related SDGs, giving special attention to the needs of the most marginalized people. And COVID-19 is hitting the most vulnerable hardest, exploiting and exacerbating at every turn the huge cracks and inequalities in our societies. Inequalities created and perpetuated by structures and injustices that have far too long put the health and well-being of certain people at the back of the queue. The impact is devastating. On top of the intolerable loss of life, the job losses, the poverty, the increased violence against women, our progress on HIV and other diseases really does hang in the balance as we work to minimize the interruptions of prevention, treatment, and care. We believe that supporting countries means supporting communities, and this crisis shows yet again that we need to focus on structural inequalities, on access to medicines, access to justice, and the sustainable financing that will get us there. The GAP must continue to support community-led responses as a core part of this system for health. Organizations of affected people, by affected people, at the policy and decision-making tables, delivering innovative services, and ensuring accountability, saying at the community level is what's promised being delivered. GAP partners must support countries to shift to the right-based approaches to ensure access and accountability, and to adopt transformational gender equality and women's rights agendas. This is how we will ensure everyone's right to health. So going forward, I'd like to see us do even more strategic joint advocacy with what we learned through the GAP. We should put our common voice behind critical and difficult challenges and make sure that there's progress, even during these difficult times. And a last word, the UNAIDS joint program is a living example of what can be achieved when agencies across the spectrum of health and development join forces and work together. So we are thrilled to be part of this partnership. We welcome this report in our first check-in. Let's do this. Thank you.
Thank you very much, Dr. Haida, and of course the importance of strategic joint advocacy is very much welcome. May I now invite Dr. Philip Donted from Unitaid to give his intervention. Sir, you have the floor, please.
Thanks for the invitation and the work. I think that a lot of things have been said, but I think it shows that we are quite aligned in the need, in the way to work, and the goal. And I think that's it's quite important. We are also an organization that by design is built with the partnership. And of course, as you know, we are focused on innovation. We try to work with the country to make sure that we understand the needs, but also to look at innovation as a solution to fix the problem. And I think that what we have been doing as Unitaid, but also collectively, is to transform access to care. And not only access to the tools, and we need the tools, but it's more the transformation in terms of what can be done at primary healthcare level, which is absolutely important and key. In a way, we have started with HIV, a very technical, very medical way to deal with the disease and transform, because we have the new tools, we have simple treatment, very effective treatment, also more way to test and to find the missing people that can be done at the community level with a strong empowerment also of the people in need that can be part of the solution. So I think it's something that we share in terms of value, and I think it's reflected in the approach of the GAP. Clearly, there is no point that to do the work if it's not to understand better what is needed by the countries, what is needed by the communities. And I think that also the experience we have collectively working together, I mean outside GAP, of course, reinforced the potential to be successful. I believe that, and in fact, it was also made as a point, that it's very important to select the priorities, to have a strong leadership of WHO, and to make sure that what we are trying to do is understood at the country level and also by the communities. I just want to, again, reiterate, because it was a point just made previously, that innovation is a tool. We can be transformative. I think the idea is to have a more systematic approach. And when you put innovation, the right tool, in the hand of the health workers, the community, and the people themselves, this will drive the change in terms of access, in terms of equity, in terms of progress and sustainability for the health system. Thank you, and we are happy and proud to be part of this initiative. Over to you.
Thank you very much, Philip, and our sincere apologies for the initial challenges. May I now invite Mr. Amir Abdullah of the World Food Programme to give his interventions. You have the floor, sir.
Thank you very much, and Dr. Tedros, really nice to see you leading us on this conversation, having led us through so many others. But good to be with you, and Excellencies, Executive Director. Unfortunately, David Beasley was traveling, so unable to be here to place on record WFP's unwavering support for the wider GAP initiative, and delight at receiving this progress report. The GAP, the Global Action Plan, the initiative is a cross-cutting platform that can drive progress on the SDGs. And as the COVID pandemic has shown us in recent months, the Global Action Plan is now more vital than ever. We needed it well before COVID-19, but this is bringing it into sharp relief. And just to say, you can count, as I said, on WFP's unwavering and continued support. COVID-19 has, unfortunately, in just a few months, turned our world upside down. The devastating effects in terms of rising unemployment, shattered livelihoods, raise of rights and others are playing out before our eyes, and their impact on already stretched health systems, really cannot be underestimated. We are seeing the number of acutely food insecure people rise, and our fear is that in the countries we serve, 80 countries where pre-COVID, we had about 150 million people who were food insecure. That's rising up to closer to the 300 million mark. And against that backdrop, it's now more important than ever that we work to drive progress on all sustainable development goals. But here we're thinking especially about SDG3, good health and well-being, and for us, how it plays into SDG2, zero hunger and better nutrition. And for all of us, SDG 17 on partnerships will underpin our success or failure in this endeavor. And the Global Action Plan provides that ideal platform to support an effective, integrated humanitarian, health, socioeconomic response to this unprecedented crisis. And I would be remiss to say if it didn't also include a very, very strong gender focus, which we find extremely important. If we are going to get this right, in my view, it is the women of the world who will lead us out of where we are today. We have a long-standing commitment to working through the GAP. WFP co-leads along with WHO one of the work streams focused in innovative programming in fragile and vulnerable states, areas that have impacted most. But just to say, this type of action plan is the integrated, we've always said every SDG is integrated with the other, and we need an integrated action plan, and we are delighted to be part of this one. So Dr. Tedros, once again, personal thanks to you for your leadership at this very difficult time. We are glad to be here with you. Over.
Thank you very much, Mr. Abdullah. We will now have the last of our speaker for our principals, and that will be the Executive Director for UN Women, Mpumzile Maplonkuka. You have the floor, ma'am.
Partners and signatories of the Global Action Plan for Healthy Lives and Well-Being for All. Ladies and gentlemen, we all know too well how COVID-19 is exposing inequalities across our societies, in our institutions and systems, making them vulnerable to health, climate, economic, and the pandemic is also pushing critical gender issues to a breaking point and threatening decades of hard-won progress for women and girls' rights. To build back better, countries in a COVID and post-COVID world need what the GAP signatories have already committed to work together and with other partners to increase investment in action and gender equality, and to address the influence of gender on behaviors, norms, policies, and institutional biases, all of which affect access to rights and access to health services. As we come together today to launch our progress report, we must acknowledge our efforts so far and identify opportunities to continue to transform the health landscape around principles of equality, non-discrimination, and inclusion. We need to continue to leverage the Global Action Plan to meet the SDGs and particularly to inform the COVID-19 response. The time is now to build back better and fairer together.
Thank you very much for those kind words. I think that would end the first segment of this particular program. We've heard from our principals, all the very important partners in this GAP, and I think the message has been very forcefully drawn home that we need to collectively work together and ensure that the strategic joint advocacy and partnership is enhanced going forward, even as we support member states to deliver. We will now move to the second part of our program, which is the interventions from member states and other stakeholders. As you're probably aware, we had indicated to member states prior to this launch that anyone that wishes to make an intervention could submit their name to us. I'm pleased to inform that we have a long list of member states and other stakeholders who wish to take the floor. As you can imagine, we have a very tight timeline. We have just 2 minutes for each speaker. We will very much crave your kind indulgence that you be succinct and brief in your intervention, so we are in a position to accommodate the long list of speakers that we have for today's very important meeting. With that said, I'll give the floor to the Minister of Health, of Public Health for Afghanistan, Dr. Ahmed Jawad Osmani.
Dr. General, Dr. Tedros, distinguished colleagues, ladies and gentlemen, Assalamu alaikum. It's my pleasure and honor to be part of today's global event and represent my country. Thank you very much for giving me this opportunity. My country, Afghanistan, in the last 2 decades, have witnessed significant gains in the health outcomes by improving access to health services through establishing a network of the health facilities, community health workers, and introducing of 2 packages of health services, the basic package for primary health care services and the essential package for the hospital services. Equity and social justice was the guiding principles in those decisions, and they have profoundly paid off. However, today's Afghanistan is in a new era. We have got large, densely populated urban settings that own for around 30% of the population. In today's Afghanistan, we are facing a double burden of the communicable and non-communicable diseases. In today's Afghanistan, majority of women are dying from both maternal and non-maternal related causes. In today's In Afghanistan, more children are celebrating their 5th birthday, but many chronically malnourished. In today's Afghanistan, number of polio cases are increasing, and this year we have the highest number of polio in cases. The current health system is not responsive to the needs and changing health realities of Afghan population. In addition, COVID-19 pandemic has exposed major gaps in the system, including numbers and skills of the health workers, such as on case management and risk and task shifting, protection of the health workers, hospital ICU capacities, lack of water and sanitation, and the health facilities, gaps in the medical supply chain, testing and surveillance, and very importantly, ability to maintain essential health services as the COVID-19 pandemic prolongs. Excellencies, my team and I working to increase the responsiveness and resiliency of the current health system, integrate lessons from the pandemic, and make people's needs and preferences at the heart of our policies and decisions. The health sector transformation and reform are focused on 3 major areas: fight against COVID-19 and other epidemics, transformation of primary healthcare services, 3, reform of the hospital sector in Afghanistan. My vision for an effective, equitable, and resilient health security services and system is to adopt a comprehensive strategy that addresses promotion, prevention, treatment, rehabilitation, and palliation along the life course and throughout the health ecosystem. My message to the heads of the agencies present in this event is that the time to evolve our institutions focused from disease-specific and pathogen-specific focus to overall health and well-being has arrived. The COVID-19 has reminded us that the boundaries between being healthy and being sick is blurred. The comorbidities and chronic conditions for most of the people is a real fact, and the individuals and communities has a potential to play a greater role as co-producer and co-developer of the health that should be empowered. This is the hero to invest in health and well-being. My fellow public health experts, Afghanistan had an effective fight against the first wave of COVID-19 through its whole government and whole of society approaches. We are increasing our capacity for providing care to COVID-19 cases by strengthening our surveillance systems, increased capacity testing, started an innovative home care services to COVID-19 cases, and contact tracing, isolation, and quarantine for positive cases. We also established isolation wards throughout the chain of the care. My priority during the COVID-19 has been to keep the essential health services effective and responsive, while we are also ensuring adequate triage, isolation, and care, referral, ICU care, as well as supply chain management and data management along the care. Each year, around $300 to $600 million is spent by Afghans for seeking hospital services in neighboring countries, India and Pakistan. With the rising poverty level in the country, I think we should improve the hospital as well as clinical-based and population-based services to prevent more and more people falling below the poverty line.
Honorable Minister, we will be grateful if you could round up your statement.
Afghans poorer, and we know that the rising poverty has well-established association with poor health outcomes. Ladies and gentlemen, primary health care is the backbone of the functional, responsive, and resilient health system, and my team is working on improving the modality of implementation of primary health care services. Our focus is to improve the access to maternal, child, basic health services by establishing family health houses in every village of Afghanistan, so that the health and immunization services are provided at village level to every mother and every child. Besides improving access, we are working on improving the quality of the health services by modifying the current mechanism of contracting out to health service providers.
Honorable Minister, my
sincere
apologies. We will have to ask you to conclude your statement so we can consider the other speakers on the list. Thank you for your kind indulgence. If you could conclude for us, please.
Okay, thank you very much. Let me say that Afghanistan is passing through a number of the transitions. The transition from war to peace, the transition from disease-focused programs to programs that enhance equity, wealth, and well-being. The transition from the traditional way of the health sector, leadership toward the stewardship of the sector that's based on evidence, innovation, and results that take into account the needs and preference of the both rural and urban population. Transition are most vulnerable and inspiring times. I and my team and the Minister of the Public Health need your guidance, technical and financial support to make Afghanistan fully free, to build a responsive and resilient services, and to ensure that quality primary healthcare services are accessible to all Afghans. We are thankful for all support provided to the health sector of Afghanistan. I and my team are working to, are looking forward to working with you in taking this agenda forward together. Thank you very much.
Thank you very much, Honorable Minister. We would kindly entreat other speakers to try to be as brief and concise as possible so that we can go through the very long list that we have today. But thank you very much for your intervention, Honorable Minister. I have the pleasure now to invite the Federal Minister of Health for Germany, Mr. Hans Spahn, to make his intervention. You have the floor, please.
Dear Director General Tedros, dear colleagues and participants. First of all, I would like to thank you, Tedros, and the World Health Organization for the invitation to the launch of the 2020 Progress Report on the Global Action Plan for Healthy Lives and Well-being for All today. Germany very much appreciates the leading role of the WHO within the Global Action Plan and throughout its first implementation phase in the past months. This plan is a remarkable example for multilateral cooperation, and Germany is optimistic about the results that have been achieved throughout the first implementation phase of the Global Action Plan so far. However, the current pandemic is threatening hard-won improvements towards reaching SDG 3 and could set us back by years. Thus, the Global Action Plan is more important than ever in order to bundle our efforts and face this challenge together. I would like to highlight two key achievements of the Global Action Plan, also in the light of the ongoing COVID-19 pandemic. The first one is that the Global Action Plan provides answers on how to provide multilateral support to countries on health. The COVID-19 crisis highlights once more that global challenges also need to be addressed globally. Hence, strong multilateralism is the prerequisite for successful coordination in the Global Action Plan, but also in global health in general. Lessons learned throughout the first phase of the Global Action Plan can be used to adjust and further support its objectives. The Progress Report reflects the strong collaboration and coordination of the 12 signatory agencies to support short, medium, and long-term action in response to COVID-19. This is best practice when it comes to acting together to face the pandemic. Secondly, I commend the achievements on the country level, especially with a view to strengthening and scaling up primary health coverage. Improving primary and universal health coverage is a prerequisite to building up resilient health systems. To achieve progress in accelerator topics such as digital health, tailored programs and mechanisms that incorporate international and local stakeholders are crucial. The World Health Organization and the other GAP partners need to remain focused on their responsibilities and should not allow COVID-19 to jeopardize the attainment of SDG 3. Germany is convinced that the Global Action Plan will play an important role in achieving progress towards the health-related SDGs. It also signals strong support of the World Health Organization and other Global Action Plan partners in this joint commitment. Thank you very much indeed.
Thank you very much, Honorable Minister Spahn. We have the pleasure now to welcome the Minister of Health of Ghana, Honorable Kweku Agyemang-Menu. Sir, you have the floor.
Thank you very much, Jude. Dr. Tedros, our principals, colleague ministers, as one of the countries whose heads of state urged the development of the Global Action Plan for Healthy Lives and Well-being for All. I am pleased to see the progress made since His Excellency Nana Addo Dankwa Akufo-Addo, President of the Republic of Ghana, joined his German and Norwegian counterparts in launching the plan at the UN General Assembly in September last year. I am particularly pleased to note the benefits that Ghana has and continue to derive from the work that the 12 multilateral agencies have undertaken together so far. Ghana is strongly committed to universal health coverage, as evidenced in the ambitious UHC roadmap that we have prepared to guide our journey towards our UHC goals. Expanding our positive approach to primary health care and strengthening our national health insurance scheme are key pillars of this effort. Funding is key to our success, hence the need to mobilize new resources for health. The GAP signatories are playing a key role as we look to operationalize and fund our UHC roadmap and update our health financing strategy. The GAP is helping to fill gaps. That is its goal. Gaps in technical support, in capacity, and in financing. It is bringing the coherence, coordination, and collaboration that we need and expect from the multilateral system. As we tackle the immediate crisis of COVID-19, the Global Action Plan is critical to ensuring that we do not lose track of our journey towards the health-related sustainable development goals. We welcome the progress made so far. We look forward to even stronger collaboration for better health in the coming years. Thank you very much for your attention.
Thank you, Honorable Minister, for your succinct intervention. May I now invite the Honorable Minister of Health for Norway, Honorable Mr. Bento.
Director General, ladies and gentlemen, Excellencies, colleagues, dear friends. 1 year ago, we were not on track to reach the health-related sustainable development goals and targets. 1 year ago, the Global Action Plan was launched to help us accelerate the progress toward this end. 1 year ago, we could not predict the pandemic that now threatens to reverse the progress we have made. With today's launch of the progress report, we are reminded that the deadline for the SDG is only 10 years away. The Global Action Plan is more important than ever. The message today is clear. We must step up action on the targets where we are furthest behind. We must remain focused on this important instrument for working together to ensure healthy lives and well-being for all. The pandemic has taught us 3 very important lessons. First, health is fundamental to national welfare, economy, stability, and security. Provision of basic health services without causing financial hardship should be priority number 1 for any government. Building strong primary healthcare systems that includes everyone is absolutely crucial, not only for the individuals, persons, or a country's preparedness, but also for the world's security. Because no one is safe until everyone is safe. I am very pleased to see from the reports that great progress has been made in the primary healthcare and financing accelerators at the country level. Second, cooperation is key. Collectivity challenges require collective solutions. I'm pleased that GAP has contributed to improve cooperation among the 12 agencies. I hope this means that the efficiency of our efforts has increased so that we get more and better health out of every dollar spent. Going forward, we should look into how to strengthen the engagement with civil society organizations and country and community level. Third, leadership and building trust is essential. We must uphold trust in the World Health Organization, in governments, in the GAP agency and each other. As highlighted in the report, cooperation contributes to improving mutual understanding and strengthening trust. Going forward, creating synergies between the COVID-19 focused and the SDG focused cooperation should be a priority. Ladies and gentlemen, Norway remains a consistent partner for our common future. We are determined to continue working with others to ensure health for all by 2030. The Global Action Plan is in the much needed tool that will help us get there. We will leave no one behind. Thank you.
Thank you very much, Honorable Minister. May I now invite the Honorable Minister of Health and Social Protection of Somalia, Dr. Nuh. You have the floor, ma'am.
Thank you so much, sir. Dear Director General Tedros of WHO, heads of GAP signatory agencies, excellencies and colleagues, a very good morning and an afternoon to all of you. I'm happy to be with you in this principals meeting of GAP signatories today. The Global Action Plan for Healthy Lives and Well-being for All is a right step for ensuring health and well-being. The good vision and intent of this Global Action Plan needs to be translated into concrete results at the country level. This is the only way we will be able to celebrate the success. Let me first begin by saying that the COVID-19 has given few lessons to all our humanity. Our health systems can be as strong as our weakest links. We are all equally vulnerable until every country is safe and protected. Protecting health of vulnerable countries is not a choice, it is a moral imperative. We all have a role to play in building back better. I am representing Somalia today, a country which has suffered and continue to suffer from protracted crisis and complex humanitarian emergencies. The profound effect of this crisis has weakened and fragmented our health systems, created a huge loss of human capital, and this has been reflected on our health indicators such as high maternal and child deaths, low immunization coverage, and depleted access to health care. The decades of conflict and silence have also led to economic marginalization and social exclusion of our young people who comprise 70% of our population, as well as other vulnerable people such as women and children. These are the drivers of poverty and resultant health inequity in our country. In this trying background, we are optimizing every opportunity to improve health and well-being for everyone in Somalia. As COVID-19 evolved in Somalia, several tragic events also unfolded. The weakened and fragile health system has strained other essential healthcare services. As a fallout, we might see a lot of our health gains pushed back or reversed. The life-saving vaccination coverage, which is already very low, may drop by 20%. Facility-based delivery will decrease by 4%, and childhood mortality can increase by 13%. The economic downturn of this pandemic on a country recovering from this crisis can equally be catastrophic, leading to a negative impact on health. The big question is, can we turn the current situation to opportunities? As we recover from COVID-19 and rebuild our health systems on the basis of what we have seen as weakness of our system, I also urge our development partners, especially the GAP signatories, to understand more than ever our local context, health priorities, value of having a strong, collaborative and cohesive partnership that's led by the government. And last but not least, the shared responsibility and commitment to monitor and evaluate the result of financing in the health sector. Let me highlight a few points as our knowledge on how our health systems can recover better and stronger from the COVID-19 is increasing. More than ever, we need to act together and push for achieving universal health coverage using evidence and data on what works in fragile and vulnerable settings and what are the low-cost but high-impact health interventions. We need to rebuild our systems and ensure that services are accessible, affordable, and equitable to all. The revised essential package of health services, which is the product of multi-stakeholders collaboration, including the NGOs and the civil society organizations in Somalia, should serve as our guide for delivering primary health care services to the majority of the Somalis. While we could accelerate the primary health care services, we should not forget to invest on community-based care as well as on secondary level care as part of healthcare continuum with a functioning referral pathways. A strong health system based on primary health care should be the foundation that we should not exclude other people's need. We should move away from compartmentalized and vertical diseases-specific control program to a more holistic approach aimed at building strong and resilient health systems. This is something that we should strongly advocate for. Time has come to evaluate the result of verticalization of this disease control program, whether or not such investment over the years have contributed to building resilient health systems in fragile and vulnerable states, which, as we all know, is an essential prerequisite for the success of any health program. Somalia would be ready to participate in any multi-country studies on what it takes to rebuild a resilient health systems in fragile and vulnerable states, should the GAP signatories agree to support such initiative in future. We need to generate evidence through our work, apply the lessons locally, and measure the impact of our investment. We should all commit the government and our development partners should be accountable to the result that we achieve in support of a strengthening health system. The links between health systems strengthening and best values are not well understood, which need to be explored. We need to invest on building capacity of public institutions in fragile and vulnerable states to address the critical capacity gaps that exist in the ministries of health of fragile and vulnerable states, owing to loss and migration of human capital. This will ensure good governance, stewardship, and enhance ability of government to manage their own public health programs effectively and efficiently and at scale. It's also important that the GAP signatories support the existing government's structure of multi-sectoral and multi-donor coordination mechanism and not forget fragment or weaken it. And I should point out that if the current level of funding, both from domestic and external sources, does not drastically improve, many countries in the developing world, and indeed Somalia, will not be on track of meeting the health-related indicators of sustainable development goals. The global ambition to accelerate progress on universal health coverage are increasingly unlikely unless concerted actions are taken and countries can better translate health spending in improved performance. The current universal health coverage index for Somalia is 25 out of 100, which is far from the global average of 60 achieved in 2019. We have to take a collective action on this. We have to engage, accelerate, and align our actions. Somalia has launched its universal health coverage roadmap in 2019. We are on the verge of rolling out essential package of health services with the goal of improving access to health care for everyone, everywhere in the country. We are working hard to design our health services delivery in a way that supports universal access, ensure inclusivity and equity, leaving no one behind. While I can assure increased domestic financing to support this rollout, I also urge all GAP signatories to support and fund this government's vision in a coordinated manner. Crisis can unlock opportunities. It's possible to advance both health and development if done properly. We must remember that in this interconnected world, good health in fragile states are indispensable for global health security. I will end by saying this to all GAP signatories, that unless we win our fight against inequality and inequity in health systems anywhere in the world, and unless we commit ourselves to build functional health systems in fragile and vulnerable states, we will not be able to achieve victory and meet the global health goals. I thank you for your time and giving me the opportunity to speak with you. Thank you again.
Thank you, Honorable Minister, and thanks once again for making the time to be with us. May I now invite the Ambassador of Canada, Your Excellency Leslie Norton, to take the floor. Ma'am, you have the floor, please.
Thank you and good afternoon, colleagues. Thank you, DG Tedros, Peter, and the representatives of all of the signatory agencies for providing this welcome update on the Global Action Plan. For Canada, the GAP is an important mechanism to strengthen collaboration and coherence in support of country efforts to achieve the health-related SDG targets. This is very much in line with UN development system reform, but expands the circle of the spirit of that reform to other critical global health actors, including some of the largest financing mechanisms such as the Global Fund, Gavi, and the Global Financing Facility. It is encouraging to see the progress made in the 5 case studies related to primary health care and health financing. Country demand is a critical ingredient to the success of the GAP. We also welcome the commitment from the Global Action Plan to promote action on gender equality in all the accelerator themes. We would be keen to hear about progress in identifying and implementing opportunities to harmonize strategies as well as financial and operational policies, which will help reduce the burden of transaction costs on countries. We know that effective collaboration requires the right institutional incentives and accountability structures. A monitoring framework with clear targets and milestones will be critical to getting those incentives and accountability in place. The global response to COVID-19 has demonstrated the power of collaboration. From the critical work on global supply chains to the ACT Accelerator, we've seen global health and development actors coming together in new ways to address complex challenges. We look to the signatory agencies to channel that spirit of collaboration as they support countries in addressing the equally complex challenges of safeguarding health gains and recovering from the COVID-19 pandemic with more resilient and sustainable systems for health. Thank you very much.
Thank you very much, Your Excellency. May I now invite the Ambassador of the United Kingdom, Ambassador Julian Braithwaite. You have the floor, please.
Thank you, and thank you, Director General Tedros, for this opportunity to add the UK's voice in support of the launch of the progress report of the Global Action Plan on Healthy Lives and Wellbeing. I'd like to thank the Secretariat for sharing this 8-month progress report, and it is clear there are some promising signs where better joined-up working is supporting countries, particularly on primary healthcare and health financing. We encourage each of the multilateral partners to continue these efforts, but also to use both the positive lessons and the challenges outlined in the report to continue to strengthen collaborative ways of working, specifically at the country level. It's also clear from the report that there are certain technical areas where further adjustments need to be made. Specifically, we think that further consideration is needed to identify the right incentives to achieve the goals of the GAP and make these sustainable. And we therefore believe that carrying out a joint assessment will be a constructive next step to support the GAP moving forward. We're ready to support you as you further adapt your implementation plans and your ways of doing business. And we encourage you to continue the dialogue with a wider set of stakeholders as you discuss your next steps, and we're ready to engage with you on this. So to conclude, congratulations again on all the progress that has been made, and we'll be with you as you change and adapt to strengthen the GAP going forwards and its contribution to the SDGs as we build back better from this COVID pandemic. Thank you.
Thank you very much, Ambassador Braithwaite. Pakistan, you have the floor, please.
And partners, it's my privilege to address this August forum on behalf of the Government of Pakistan. on the eve of launch of this.
Apologies, but the quality of the sound coming from the floor does not enable interpretation. Sorry.
I congratulate both WHO and our partners for their wonderful success during the last 1 year, despite various challenges, including this COVID-19 pandemic. We are confident that in coming years, with the dedicated efforts and support of our partners, especially UN agencies, Global Fund, Gavi, Global Financing Facility, we will be able to move faster to achieve the common goal of provision of better health care to the people of Pakistan in order to achieve the health-related SDGs. Honorable dignitaries, Pakistan is the 5th most populous country in the world with a population of around 20 million. And we also have a very extensive infrastructure of primary health care. Unfortunately, it's largely underutilized, and we have an index of UHC around 40 due to various challenges which include health emergencies. Traditionally, our health systems have remained underfunded. However, the present government, in its national health vision, has pledged to increase federal and provincial allocations to health sector to around 3% of gross domestic product. It has also identified better coverage and more functional primary healthcare services as its strategic priorities to achieve universal health coverage. Pakistan has recently developed new universal health coverage benefit package based on disease control priority 3 program for community primary health care centers and first level care facilities, which will shortly be launched in selected districts across the country with support of Global Financing Facility and other partners. Several other important initiatives have also been launched to reduce the financial hardship by introducing social health protection for the poor families. We recently registered 6.9 million families across the country to get health care at quality hospitals against a target of 10 million families. In order to achieve sustainable development goals, the collaborative efforts by the government and development partners are required. This GAP forum is indeed, it will be providing a platform to augment the efforts by different partners and put the journey on fast track basis. In order to have an effective coordination amongst partners, we would support the initiative of establishing a partners coordination committee on GAP agenda at national level with well-defined objectives and modalities. I would also like to appreciate and congratulate World Health Organization for steering this crucial initiative and organizing this successful event. Let me assure on behalf of Government of Pakistan for all support and presentation for the forum. Thank you very much.
Thank you very much, Pakistan. We will now give the floor to the Acting Director General of Health Service, Ministry of Health, Sri Lanka. You have the floor, sir.
Your Excellencies, DG WHO, distinguished delegates, good evening to you all. I am honored to be part of this launching and would like to appreciate the support that Sri Lanka receives from WHO and the other SDG3 Global Action Plan partners. Under the leadership of His Excellency Gotabaya Rajapaksa, as national policy, all ministries in the government align their plans and budgets to the relevant SDGs. The Ministry of Health has initiated the development of a National Action Plan on Health and Well-being of Sri Lanka in 2019 and will be continued with increased focus on strengthening and resilience and preparedness of the health system to public health emergencies. We would need to prioritize and ensure value for money approaches in our strategies and plans to continue our journey towards universal health coverage despite the economic impact of COVID-19. We also need to align and harmonize donor support to one National Health Plan. Distinguished delegates, to monitor our progress, a SDG3 tracker was developed with strong accountability mechanism for the indicators up to the subnational level. On SDG3 GAP accelerators, I am glad to inform that Sri Lanka has significantly progressed in the primary healthcare accelerator in line with our efforts to prevent and control the high burden of NCDs. I would particularly want to mention the important work we are doing with WHO, UNICEF, and local authorities on pilot health cities using settings approach in workplaces, schools, public space to create enabling environment for healthy lifestyle. Thank you.
Thank you very much, Sri Lanka. May I now invite Dr. Judith Labia of Jamaica to make her intervention. You have the floor.
Good morning, good morning, good afternoon, everyone. I'm speaking from Jamaica. It is my pleasure to represent Jamaica. Let me acknowledge our Director General, Dr. Tedros, and all excellencies, and our distinguished guests. Let me congratulate the entire group on the Global Action Plan for Healthy Lives and Well-Being for All, and for this first progress report. Jamaica is very grateful for the support that it has gained in the field of child and adolescent mental health services. The funds that we received, the support that we have received, launched a virtual trainer of trainers for school mental health literacy for a group of master trainers from both our Ministry of Education and Ministry of Health. We propose to roll out a training of school personnel within the next 6 months so that mental health literacy of both our school personnel and our students in the age of 13 to 16 will be considerably enhanced. We'd like to acknowledge collaboration with UNICEF, who has supported us in the initiation of telemental health services throughout our primary care system, in our child and adolescent mental health services, in our child guidance clinic, and also upcoming launch of a chat line, which will join up with our mental health and suicide prevention helpline throughout the country. We're also collaborating with UNDP and UNFPA regarding gender-based violence and challenges in the sexual and reproductive health. Once again, let me say thanks from Jamaica for the assistance given by this GAP initiative, and to pledge our continued collaboration and work in the area of providing mental health services, access and literacy for our children and adolescents. Thank you.
Thank you very much, Dr. Liba of Jamaica. I have the pleasure now to invite the Deputy Director General of the European Commission, Majed Tajaga. You have the floor, ma'am.
Thank you very much, Dr. Tedros, DG of WHO, Excellencies, colleagues. On behalf of European Commission, let me welcome this GAP report and the progress made. Now, more than ever, in these COVID-19 times, it is critical to make further and faster progress, from the increasing alignment to maximizing the value for money and the use of the health resources. GAP has a huge potential to stimulate innovation in health.
Okay.
Thank you. So GAP has a huge potential to stimulate innovation in health. And COVID-19 can also be an opportunity to ensure a different and more effective approach to cooperation. The European Commission and our President, personally, we have been in the center of these efforts from the start of the pandemics. And we see GAP as an important mechanism to achieving results and controlling the pandemics. Let me add that the effective articulation and alignment with the ACT Accelerator is very important here. So the COVID pandemic reinforces what we all know, that the universal health coverage is the best way to secure the health of individuals and the population. The GAP progress has to play a strong role in helping to advance progress towards the universal health coverage, ladies and gentlemen. Building on the collaboration between the private and public sector on the COVID-19 response, we also need to address SDG funding gaps further. Let me conclude. Given the health crisis we currently face across the world, there is no time to waste. You can count on the continued support and cooperation from the European Commission. Thank you very much.
Thank you very much, Majeta. May I now invite our colleagues from civil society representative, Dr. Justin Kunen. You have the floor, please.
Thank you so much. Can you hear me?
Yes, we can. Please proceed.
Great. And sincere apologies, my video does not seem to be working, but I am here. So thank you so much for the opportunity to say a few words on behalf of the people who will be the ultimate beneficiaries of your collective efforts to engage with countries to align, to accelerate, align, and account. And that is the people, the communities and civil society organizations working at the coalface. A year ago, at the launch of the Global Action Plan in New York, we heard Jan Willem Scheegman describe the GAP somewhat memorably as a wedding between the 12 signatory agencies and member states at which civil society, the private sector, and young people were enthusiastic best men, maids of honor, and bridal party. And as the first anniversary of the wedding approaches, one might be led to believe that the newlyweds were having so much fun on extended honeymoon, something we celebrate, that they'd forgotten to send a postcard home. The truth is that opportunities for civil society engagement in the GAP thus far have been limited, both at the global level and particularly at the country level. We welcome this progress report on the Global Action Plan, and in particular, its acknowledgement that more attention is needed to strengthen the engagement of civil society in GAP processes. We acknowledge that the GAP is largely a multilateral rather than a multi-stakeholder process, and at the same time, we're deeply invested in its success. Civil society will be following up this report launch with a webinar of our own to discuss with our own colleagues how the GAP has progressed and how they can contribute to its success. We're excited at the openness this progress report describes to country-level demand from civil society, but we need our country colleagues to know what the GAP can do and what the possibilities are for engagement. And so we'll be following up with the GAP Secretariat in developing a more structured process for civil society engagement in the GAP at global, regional, and country levels. The COVID-19 crisis is exactly the kind of situation the GAP was expressly built for, to support countries in their critical time of need and to ensure both resources and actors are mobilized efficiently. We can't let this opportunity to show the value of the GAP go to waste. And more clarity is needed around how the GAP relates to some of the new pandemic-related global collaborations, like the Access to COVID Tools Accelerator. There's still a mountain of work and of possibility ahead, and we continue to stand beside you all as enthusiastic and cooperative partners, fully cognizant that your success is also our success. Thank you.
Thank you very much, Justin. May I now invite the Secretary General of the Ministry of Health for Mali, Dr. Mama Kuma. You have the floor, sir.
Okay,
Thank you. Can you hear me clearly? Yes. Just so we can hear you. Good afternoon, everyone. Director General of the WHO, ladies and gentlemen, directors of agencies, can you still hear me? Very well then. As I was saying, good afternoon, Director General and ladies and gentlemen. I'd like to thank you for the invitation of my country to this important exchange meeting. Thanks to the implementation of the health network, we were able to increase our coverage significantly, and this has allowed us to increase high impact services like vaccination, as you're well aware. We were able to make great strides towards SDG by training staff. We've been able to decrease by a factor of 3 diseases in our country and to reduce mortality and morbidity. Too many young women, mothers and children die in Mali. Nevertheless, the financing of the PHC sector does increase the quality of service and health services. This is a great stride towards universal health coverage. And obviously, the security situation in our country has sometimes served as a barrier to progress. Primary health care is very important, especially at the community level. In 2019, we have tried to increase services for care of young mothers and children, especially in the field of nutrition. This is one of our priorities. And I would like to say that Mali is ready to work hand in hand with all of the agencies of the GAP as a partner. But Mali is in a difficult period, and it's needed more than ever unity and collaboration to ensure the continuity of services, health services in our country, and to fight against diseases like tuberculosis, malnutrition, and to ensure that women and children have a sufficient social coverage. Despite certain actions like the immunization of women and young children, Mali is still suffering from many difficulties. But with the efforts in 2020, we do hope to move forward. But we've already seen some negative results. The situation, therefore, is very fragile, especially for the most vulnerable members of the population in Mali. We really need help from our partners, a sustained effort on their part, be they the signatories of the GAP or others. We really need to be part of their strategy and plan of action. This in order to achieve our objectives. All 12 agencies and all other partners have to be mobilized to finance primary health care at the community level, and this also includes sufficient salaries for medical staff. We need better continuity of essential services like vaccination, dealing with malnutrition. If we analyze the cost and the impact of financing of health services, we can see that this will lead to an acceleration of care in our country. We need to strengthen the digitalization, numerization of health services, and we also need take other innovative steps to improve the healthcare system. We need to put in place common financing for the priorities of the country, and the financing has to be reliable and independent of the party that's financing us. We need a mechanism to measure performance of primary health care and the initiatives of the partner agencies. We also need a way to better harness the financing that we receive. Thank you.
Very much, Secretary General, for those words. That concludes the interventions for today. I'll yield the floor to the Director General, Dr. Tedros.
Thank you, Jude, and thank you, Excellencies, colleagues, dear friends. Now we're closing, and thank you so much for joining today. Maybe I'll repeat some of the things said. As the Minister of Health of Norway said, this global action plan is more important than ever before. And all of you said the centrality of health. And in the SDGs, you know, it's very clear now that health is central. And of course, you have emphasized the centrality of cooperation also to achieve results, whether it's the SDG in general or health in particular. And the result should be at the country level. And the most important part of the cooperation is, our cooperation is when we can deliver result at country level. And the countries themselves being the owners and the drivers of the change and the result. So with that, again, Global Action Plan is more important than ever before, and on behalf of my colleagues, all the agencies, we would like to commit to Your Excellencies, the ministers and other representatives of many of the member states who have spoken. We will make sure that we support you in the best way we can, and we believe in cooperation and bringing result at country level. With that, thank you so much again, and to my colleagues, agencies, I think we have already agreed to meet in about a month to continue our work together, and all the best from my side. Thank you so much.